Welcome to the BeWell Center at Tufts Health Plan. We're the corporate health center for you here. We do everything for you except for your complete physicals. Anytime you get sick, come on down and see us. And we have just started a new program of Well Women exams, which of course includes all women's cancer screening. My name is Bonnie Nother.
And I'm Janae Taylor. I'm the medical assistant and phlebotomist here on site.
Oh, that's right, yeah, because Janae can do all of your lab tests for you. You just have your doctor give you a lab order sheet, and we can take care of that. The results will be sent directly to your doctor.
Yes, that is true. And Bonnie, I also understand that there has been a change in the guidelines for the cervical cancer screenings.
That's right. And this is very new. It used to be we had to go for annual pap smears, et cetera, but that's just not the case anymore. The new guidelines say that we don't even start pap smears until somebody is 21 years or older. It doesn't matter about whether they're sexually active or not. We just don't do it until the age of 21. Now, the other thing is that I mentioned that we don't do annuals anymore. It's really every 3 years that people have pap smears. One of the things that your doctor may talk to you about is if you've had 3 normal pap smears in a row, then you would go to the every 3 years. Now you might say, wait a minute, what if I was having cancer and I'm only getting checked every 3 years? Guess what? Cervical cancer actually is very, very slow growing, and it takes a very long time to be a problem. So it's not dangerous at all to be only checked every 3 years. Now that's between the ages of 21 and 29. Now ages 30 to 65, it's actually every 5 years. This is very different. This is much less. There's also the issue of being screened for HPV. Now, most of the women who were born after, maybe 1980, 1985, have had the HPV vaccine. Wonderful. That protects you against the dangerous kinds of HPV. Now, why do I say that? Because it turns out there are probably about 100 different kinds of HPV, but only 4, maybe 6 kinds actually ever come up with causing cancer. The other ones, unfortunately, do cause things like warts, which are never a crowd pleaser. So it's good that everyone's getting their vaccines. In case you're wondering, the guys now do get their vaccines. But that really didn't come in until probably maybe 5-10 years ago. So the boys who were born after, say, 1990, many of them have also had the vaccine. So anyway, getting back to ages 30 through 65, again, if you've had 3 normal pap smears in a row, it's every 5 years. And if you're HPV negative, there's actually even less often screening. And I mentioned 65. Usually after 65, we really don't need to have pap smears anymore. This is big news, because it used to be that every woman thought she had to have a full exam every year. And that's just not the guidelines anymore. Now, this is a little different for women who have an immune problem such as HIV. That woman is going to be screened a lot more often, just because her immune system isn't quite as strong as it used to be. And we are available to do the pap smears, to do breast exams for you. Breast exams, there have also been changes in that. It used to be that we were constantly telling people that they should check their breasts once a month, and there were all kinds of guidelines about when you should do it, and this, that, and the other. Now, we're actually not encouraging people to necessarily do their own breast exams. Why? Because people were finding things that turned out to be no problem at all. In fact, 99.99% of the things that women thought were problems were not. So we actually don't recommend doing the exams anymore. However, it would be a question of personal preference, and I think any provider, including myself, would be very happy to answer any questions about that. And in fact, really any of these questions. One question that comes up a fair bit is, if I've had a hysterectomy, do I still need a pap smear? If you still have a cervix, then you might need to have pap smears, but no more often than anybody else, or no more infrequently than anybody else. So those are some of the new guidelines.
And I think I have another question that might often come up as well with the breast exams.
Mm-hmm.
Anybody that has the cancer in their family, is that a change for them as far as when they would get theirs checked?
That is a wonderful question, because it depends on what kind of breast cancer. Now, a lot of times when I say that, people say, what do you mean, what kind of breast cancer? The major question is, how old was your relative? And it, by the way, has to be a first-degree relative, which means your mother or your sisters. Not your aunts, not your cousins, not your second cousins. It's your mother or your sisters. How old were they when they were diagnosed with the cancer? If they were diagnosed after menopause, so in other words, after about the age of 50, 55, that's a whole different thing. That's just, that's not inherited. Under that age, then we would encourage that relative to consider maybe being tested for having genetic testing, which they can go ahead and do. And then we would encourage the patient to talk with their doctor and find out what kind of testing they might do. It's a complicated question. You know, anytime we're talking about cancer, and of course breast cancer, it's not a one-size-fits-all. I am just mentioning that we now are not even doing mammograms quite on the same schedule that we used to. So we would encourage people to talk with their doctors and talk with their families.
Thanks for tuning in, and hope you enjoyed the video. Any questions, you know where to find myself, you know where to find Bonnie. You can certainly schedule their appointments through myself by my extension number, which is 58398, or you could also go on the portal through the intranet and schedule an appointment time to speak with Bonnie to answer any questions you still have.